Welcome to Home Care Matters, the show where we discuss all things home care, with discussions on important age-related matters and topics. Brought to you by Enriched Life Home Care Services, the #1 rated home care provider in Michigan by Top Rated Local.
Hello, and welcome back to All Home Care Matters. If this is your first time visiting us here at the show, thank you for taking time out to be with us today. We appreciate how valuable everyone's time is, and that's why we try and make each episode here at All Home Care Matters something that will hopefully matter to you. Now, if you're caring for a family member or loved one with dementia, then you may be experiencing what many families experience when it comes to your sleep. When a loved one with dementia or Alzheimer's doesn't sleep well, you're probably not getting enough sleep either, and after a while, it begins taking a toll on you and your loved one. That's because quite often, when someone is diagnosed with dementia, they can become increasingly restless, confused, agitated, or distressed, particularly when it begins getting later and later in the day. This is known as sundowning. This issue is one of the most frequently raised questions that we receive from families who have a loved one with dementia. And on today's episode, we're going to be discussing tips and suggestions to help you and your loved one with getting better sleep. Have you noticed that as it begins getting later in the day and begins getting darker, that your loved one's behavior starts changing? This is usually because individuals with dementia often feel or have difficulties with the changing of the day, and some of these difficulties could be from them not being able to get the proper sleep. This can lead to a proliferated confusion, anxiety, and becoming more easily agitated, which is more commonly known as sundowning. When your loved one with dementia doesn't sleep well, you're probably not getting enough sleep either, and this lack of sleep can lead to frustration and exhaustion for you, as sleeping is paramount for all of us. Dementia and sleeping difficulties often go hand in hand. Disturbances in sleeping patterns are common among people with dementia and can become more problematic as the condition progresses. The connection between sleeping and dementia is common for individuals who are facing this disease, and their caregivers and family will usually say that they see these changes firsthand. Now, it's common to have a change in the pattern of sleep in older adults, irrespective of having dementia or not. Many senior citizens usually experience a change in their quality of sleep, the number of hours that they sleep, and how much time they spend awake at night. But these sleeping difficulties get more complicated and even more common in people with dementia. Individuals with dementia will experience excessive daytime sleepiness and naps associated with fragmented sleep at night as a result of that. And there often can be several short duration naps throughout the day to make up for the sleep they've lost the previous night. The most important issue for anyone, whether it's the family or their caregivers, that needs to understand is seniors with dementia are experiencing their own realities. And to appease a senior's agitation and aggression, family, caregivers, and loved ones need to tap into this reality and embrace it. Your loved one with dementia is likely to experience difficulty maintaining or falling asleep, which can be caused by insomnia, problems with the sleep cycle, or it can be a side effect of medication or other factors. The sundown syndrome, which is common in people with Alzheimer's and other forms of dementia, can contribute to problems with sleep. Problems with movement during sleep, such as restless leg syndromes, which is characterized by an uncomfortable urge to move the legs during periods of rest, or rapid eye movement. Sleep behavior disorders, which makes people act out from their dreams. Another experience they may be facing is breathing disorders during sleep. Affects about 50% of the people with Alzheimer's. But remember, regardless of what issues they are facing with their sleep, practicing patience is crucial for the family, as older adults will express all of these attributes. They're just the factors when facing dementia. Also, some people with dementia tend to sleep unrestrained during the daytime, and it's very possible that they may not be able to control this nap, which affects their bedtime at night and overall quality of life. So we want to take the next few minutes to share some tips that are hopefully going to help the family in coping when their loved one with dementia exhibits these difficult behaviors. First, music. Actually, music therapy helps seniors calm down and reflect on happier times. According to the Alzheimer's Association, listening to music releases dopamine in the brain and triggers happy feelings throughout the body. Another option to help handle this behavior is aromatherapy. According to a study in the BJ Psych Advances magazine, using scents like lavender can help reduce difficult behaviors in older adults with dementia. Some of the benefits that come with this are improvements in the quality and length of their sleeping pattern, and a decreased level of agitation, and improvements with higher concentration and reduced hallucinations. Another good way is by touch. A gentle touch can create a bond between the family or caregivers with their loved one with dementia. Just a soft and gentle hand rub or pat may be a way to reduce agitation in someone with dementia, and it helps in building and increasing their trust. Some other ways to help in handling the difficult behavior is pet therapy and using a calmer approach. These behaviors can also often be determined by their first interaction with their family or their caregivers, but also remember to provide them with plenty of reassurances and support. Excessive daytime sleepiness is quite common in people with Parkinson's disease or Lewy body dementia than in those with Alzheimer's. And some factors that may contribute to excessive daytime sleepiness are sedating medications, changes in sleep pattern caused by dementia, mental health conditions such as depression, insufficient sleep at night, and some sleeping disorders such as sleep apnea. Researchers and doctors don't understand why exactly dementia affects sleep, but up to 70% of people with cognitive impairment have sleep disturbances, according to a review of studies on disturbed sleep and dementia. Some other factors that can contribute to poor sleep and dementia are less exposure to sunlight, which affects the sleep cycle, chronic pain, the diet that they're on, such as excessive caffeine or alcohol, an inadequate environment for sleep, such as a noisy room or a bright room before bedtime, and physical or mental exhaustion at the end of the day. An interesting statistic reported by the Alzheimer's Association reveals an estimated 5.8 million Americans aged 65 and older are living with Alzheimer's dementia in the year 2020. 80% are aged 75 or older. As the number of older Americans grow rapidly, so too will the number of new and existing cases of Alzheimer's. By the year 2050, the number of people aged 65 and older with Alzheimer's may grow to a projected 13.8 million, barring the development of medical breakthroughs to prevent, slow, or cure Alzheimer's disease. And finally, we're going to discuss 8 other tips with you to help families who have a loved one with dementia to hopefully get a better night's sleep. When caring for a family member with dementia, improving sleep is probably one of the most important priorities because it not only affects them, but it also affects the family as well. And being able to get adequate rest will not only improve your loved one's mood, health, and quality of life, but also yours. But please remember, there are no guarantees or guaranteed tips that will work for everyone who has been diagnosed with dementia. A close friend of ours, who is a well-known dementia expert, likes to say that if you've seen one person with dementia, you've only seen one person. And that's because this disease affects everyone differently, and everyone responds differently to it. And what may work today may not work tomorrow, and what worked yesterday may not work today. This is what makes this disease so difficult for families, caregivers, and the individual with it. So here are the tips and suggestions that we have prepared. First, treat any pain and other medical conditions that they may be dealing with. Oftentimes, families need to be looking at the nonverbal cues. Individuals with dementia sometimes are unable to verbally express pain or discomfort or other issues that may be contributing to their difficulty sleeping. Next, check for medication side effects. If you're unsure of their medication side effects, call and speak with their pharmacy or their doctor to see if they are currently taking any medications that could have side effects that could cause any discomfort or contribute to having sleeping issues. Number 3, create a soothing environment for them. The room should be quiet, dark, and cool. It's recommended between 60 and 67 degrees Fahrenheit for a cool room for them to sleep. Next, get some sunlight when it's possible, after waking up in the morning. This tip can be difficult though for families that don't live in a constant warm climate, but if you're able to, sunlight always will help improve the mood. Number 5, encourage and assist with physical activity during the day. If your loved one has physical limitations, try chair aerobics or a range of motion exercises for them. Next, establish a sleep schedule and keep that schedule as best as you can and that you are able to. Number 7, avoid stimulants like caffeine and alcohol. Number 8, limit daytime naps when you are able. Caring for a loved one with dementia can be difficult and trying at times. Remember, remain calm as much as you can and practice patience with your loved ones who have dementia. This disease is what makes it difficult and trying, not them. If it's possible, try to include other family members or close friends so that you don't have to do it alone. And remember, reduce their stimulation as it gets closer to bedtime, and always be mindful of your health and rest. Your loved one needs you. We want to thank you for joining us here today at All Home Care Matters. All Home Care Matters is here for you and to help families as they navigate long-term care issues. We invite you to please visit us at allhomecarematters.com, where there is a private, secure, fillable form where you can give us feedback, show ideas, or if you have questions. Every form is read and responded to. And please, if you know of someone who could benefit from this episode, please share it with them. We hope you will join us next time on All Home Care Matters, where we're going to be discussing protecting our seniors from scams. Some information and data and statistics from this episode was taken from the Alzheimers.org website. Thank you so much, and we look forward to seeing you next time.
Thank you for joining us today. We look forward to you joining us again on another episode of Home Care Matters. To learn more about the show and to connect with us, visit us at allhomecarematters.com.